wanted to extend the warm welcome to everyone to join us again for the 5th Biennial Conference, the Ohio Program for Campus Safety and Mental Health. We extend our warmest welcome to you all to join us today for our opening keynote address. We are joined by Dr. David Rivera for our opening keynote presentation, Investing in the Mental Health and Academic Success of Students of Color. And so I will go ahead and introduce Dr. Rivera. Dr. Rivera is a senior advisor to the Steve Fund and associate professor of counselor education at Queens College City University of New York. He received his doctorate in counseling psychology from Teachers College, Columbia University. He also holds degrees in psychology and counseling from Johns Hopkins University and the University of Wyoming. A counseling psychologist by training, his professional experience includes college counseling and higher education administration. His research focuses on cultural competency development and issues impacting the marginalization and well-being of people of color and oppressed sexual orientation and gender identity groups with a focus on microaggressions. So we welcome Dr. David Rivera to our conference today. And he's no stranger to Ohio. He's presented to a group of our stakeholders here before. And so Dr. Rivera, I turn it over to you.
Great. Thank you so much, Jessica. Am I coming in clearly? My voice?
Yes, you are.
Okay, and thank you so much. Yeah, thank you. And it's a pleasure to be back here with you. Good morning, Ohio. I think it was a couple of years ago that I was able to have the fortune of being with you all and presenting on our equity and mental health framework, which I'll talk a little bit more about during this presentation. But I just thank you all for having me here. For those of you who are new to the Steve Fund was initially founded in 2014, so a relatively new organization. It was founded out of tragedy and loss. So a Black family, the Belrose family, lost one of their children, Steve, to suicide in 2014. And within that month, the idea of the Steve Fund grew. This family was hurting and they were looking for resources specific to Black families in terms of grieving, in terms of understanding mental health issues and how they impact families and people of color. And they really found that there wasn't a whole lot out there. And so the idea for the Steve Fund grew from this tragedy. And within that year, they hosted the first gathering of mental health experts from around the country to really think critically about how can we best serve students of color, not only in college, but across the educational pipeline, knowing that mental health issues start earlier on in age and that students need support not only in college, but pre-college, but also as they launch into the world of work. And so the Steve Fund has really galvanized its efforts, maximized its partnerships with organizations such as Ohio Healthy, and really creating a network of organizations and institutions across the country that are really invested in not only addressing these issues, but really thinking critically about how we can institutionalize supports for students of color across educational contexts. Okay, so this was the intro slide, the only one that you missed. As part of the Steve Fund's work, again, we developed the Equity and Mental Health Framework in collaboration with the JED Foundation, which produced a set of 10 recommendations and implementation strategies for colleges and universities to really take a preventative stance in terms of addressing these issues and thinking about how they can truly institutionalize mental health supports for students of color in colleges and universities. And I'll go in a little bit about this as we go forward, but this is one of our current programs that we're launching. We have cohorts of institutions from across the country who are critically engaged in a year-plus long journey with us as we help them to really formalize and institutionalize these issues on their campuses. So I want to start us off with the mindfulness moment. And I do this for a variety of reasons. Mindfulness has been one of my primary coping mechanisms over the course of the pandemic. And it's also something that I've been incorporating more intentionally in my classes and the trainings that I do and in the talks. I find that in this era of distance ed or distance work, that we are stacking our responsibilities on top of each other and not really allowing for that time in between events for kind of a mental cleanse, if you will, so that we can enter into the next space, the next event with our true and fullest self. And a mindfulness moment can help us with that. So it's just 1.5 minutes roughly, and invite you to participate as fully as you'd like.
Welcome to the sober breathing space. Sober stands for stop, observe, breathe, expand, and respond. Stop whatever it is that you are doing and whatever it is you are about to do, and allow yourself to just simply be right here in the present moment. Observe what's happening in your body, noticing any sensations that are present in your body right now. Check in with your emotions, noticing whatever feelings are there for you right now, without judging anything, just allowing them to be as they are. Notice where your thoughts are right now, whether they're in the past or in the future or in the present. With the next breath in, gathering your awareness. With the next breath out, bringing your awareness now just to the breath. As best you can, keeping your full attention on the sensations of breathing. Breathing in, I know that I'm breathing in. Breathing out, I know that I'm breathing out. In, out. Whenever you notice your mind wandering, as best you can, simply bring your awareness back to the next breath. Breathing in, breathing out. In, out. Gathering your awareness again with your next in-breath. Breathing out, expanding your awareness to a sensation of your whole body being breathed. Checking in again with the body. What do you notice? What sensations are present right now? Are they the same or are they different than earlier? Checking in with your emotions. What feelings are present right now? Checking in again with your thoughts. Where is your mind right now? And with awareness, as best you can, responding to the situation, carrying on with your day, shifting out of autopilot mode and into mindful awareness.
So thank you for going on that little mindfulness journey with me this morning. I have a feeling that there probably are others on the call or in the audience, this virtual audience, who probably practice mindfulness. And I'm speaking to a lot of mental health professionals and practitioners and scholars. And so hopefully you already understand the power of mindfulness. I often think of it as one of the mega interventions because it has many benefits. You know, it's something that's been studied in science more frequently currently, but it's also something that's been around for quite some time, probably for millennia, in a lot of indigenous cultures around the world, especially Eastern cultures. But there's a science that goes along with it as well. There's this idea of neural integration, which happens when we're kind of at our most optimal, which I would also imagine that there probably aren't many people around right now that can function at their most optimal, given the multiple stressors from the pandemic and everything else that are kind of constantly on everyone's minds, everyone's bodies, everyone's emotional journey. But what we find is that mindfulness is one of the most accessible and elegant antidotes to the neural disintegration that happens when our minds, when our brains are overly stressed. So we know that, you know, the processing slows down, our processing speed slows down. That means that parts of our brains that should be communicating with each other in a much quicker fashion actually slow down. Folks who experience even more chronic traumas or significant acute traumas can actually have significant breakdowns in communications between parts of their brains. What we find is that mindfulness can help to help to lubricate or make those connections more speedy. Studies have even found that mindfulness practices that a therapist engages in for minutes before a session with a client will yield greater clinical outcomes with their clients. So there's actually possibly a transfer that can happen between folks who practice mindfulness and the people that they come into contact with on a regular basis. As we're kind of going along, I want to invite you to include questions in the chat or the Q&A and also comments as we go along. I'm going to try to save at least 15 minutes at the end for some Q&A. I have a lot of information to share, but as we go forward, this is kind of the first resource I wanted to throw out there. That meditation that we heard comes from a website called mindfulnessforteens.com. And I'm going to pop that into the chat. I realize it only went to the panelists, so if one of the other folks on there, maybe Jessica can throw that into everyone else, that'd be great. But it's a very accessible resource, and this website, even though it's for teens, it has a lot of that pre-recorded meditation came from there, and I use them with adults often, and so I encourage you to circulate that with those that you work with, and so the first part of our talk is going to focus on consciousness raising with a racial trauma focus. Consciousness raising, bolstering our knowledge of these issues in and of itself can be a form of intervention, especially for folks of color as they are trying to make sense of the aggressions, the oppressions that we experience on a daily basis. It can be helpful to kind of understand where those oppressions originate from and how come they're so frequent in society. And they can also help us understand how the oppressions and the racial discriminations and biases that BIPOC people experience are not by chance. These are designed into the systems that we live and operate in on a daily basis, and we'll go through that. So it starts with an ecological perspective for understanding development, human kind of experience. Sorry, I have a dog right here who is healing from some surgery, and so periodically I have to encourage her not to lick her wound, so I will be distracted a bit sometimes. So this ecological perspective, what it does, a few things. It helps to remove the over-pathologization that people, especially people of color, often experience when it comes to mental health issues or other disparities that people of color experience in society, such as educational disparities, employment disparities, economic disparities, etc. For all too long, I think that we have conceptualized as a mental health profession, mental health community, that the over kind of individualization of psychopathology, which, it's important that we think about how unique manifestations of issues such as anxiety and depression can vary from person to person. However, focusing solely on the individual doesn't really help the individual to understand the full narrative, the full picture of their wellness issues and how they have come to be. And from a practitioner's perspective, taking a more ecological perspective can help us understand the various issues that impact the individual level of functioning. And so if we can think about the individuals living within institutions, institutions being embedded within communities, and then communities being impacted by the overarching public policies that kind of dictate, norms for how people are to behave and treat one another in society. But that public policy sphere isn't just about the actual laws that are put into place, but it also includes the rhetoric around these issues. This rhetoric, the talk around these laws that begins before the laws even be put into place and continues after these laws are put into place, can create a lot of the issues that the laws also can create. And so we know that we came from the last 4 years of an administration that did a lot of rhetoric around various issues, a lot of rhetoric that didn't even actualize into laws, some concerning the very topics that we're talking about today. Towards the end of that administration, there were actually presidential mandates that outlawed talks about implicit bias, talks about critical race theory in the federal government. And those are all issues that kind of frame what we're talking about today. And so we can think about how that can impact, again, just that rhetoric can impact how people kind of think about themselves. I know myself personally felt personally attacked, professionally attacked by those, because that was the very nature of my work. My work was now being outlawed. And I'm also a federal contractor. And so my work doing implicit bias trainings in the federal government sector was also on attack. And so just thinking about this can help us to kind of understand these issues in a greater way. But I also want to bring in the historical context. And so this ecological perspective is not new. We know that Yuri Bronfenbrenner gave us a lot of this language in terms of thinking about human development and educational experiences. But often what was missing was that historical context, right? Thinking about the history of, our people, of our history of, for example, of Black folks in this country, of Indigenous folks in this country, of Latinx folks in this country, of Asian American Pacific Islanders in this country, of multiracial people in this country, right? That our aggressions didn't just start with, today's current context, that it started hundreds of years ago, right? And that the history still persists. It's passed on, right? It's passed on both vocally through oral traditions, but it's also passed on through possibly the genetic damage that's been done via oppressions over time. So there's that inherited history of oppression that people in today's current context still live with as well. And it's important to recognize that. So we look at our pandemic, as being one of the primary contexts in today's society that is bringing about a lot of issues. But what it's also doing is that it's bringing to light the inequities that have long been in existence in this society. We can look at the racial disparities of COVID-19 in terms of deaths per 100,000 people. And this hasn't been updated for a while. This is, I believe these are March's figures, and I would update this periodically. And we just saw that the disparities got worse and worse as the pandemic went on. And this isn't to say that COVID was, just being judicious and attacking people of color. No, it was that the system of healthcare, the system of education, the system of employment, the system of economics in this country were already laid down to create the disparities that we now see highlighted. Whenever our country experiences any natural or human-made disaster, we often see that it's the people of color that are often targeted and that often experience the disparities most starkly. We can think back to Hurricane Katrina, for example, and we know that it was the Black Americans living in New Orleans and in the South that took and bore the brunt of that in terms of lives lost, in terms of economics lost, in terms of educational opportunities lost, et cetera. And so it just repeats time and time again. These disasters just really show us how racism is really designed into the fabric of this country, and how any disruption will just reveal these disparities as we go along. So racial trauma is also the focus of what we're speaking about. And there have been some reframes that I've been putting on this pandemic context. One thing that I was very naively thinking was that the instances of microaggressions, for example, were going to go down because people were forced to be home. We weren't interacting with people on a regular basis. But I was wrong. All we needed to do was fire this thing open, our phone, turn on the radio, or fire up Alexa, or turn on the TV with the news, and we're bombarded with traumatic images with racial microaggressions. And so maybe they even gone up, who knows? But I think that the racial trauma and the language of racial trauma is also one of the reframes that I'm taking as a positive. This language of racial trauma, we've been speaking about it, but in much smaller circles pre-pandemic. But now we're thinking of it as a term, and this is actually a much better term to really think about the issues of oppression that people of color experience. That they're actually traumatic experiences. And our mental health language gives us a nice frame for understanding trauma that really helps us to then understand racial trauma and how to address it in many ways. But where do racial traumas for students come from? This hostile campus climate, which I'll talk about some, lack of access to resources, especially resources that meet critical needs, such as adequate housing, right? Adequate access to food. We know that food insecurity and housing insecurity have been an issue, but have really dramatically increased over the past year. Microaggressions, internalized oppressions, dignitary harms, stigma associated with help seeking, the isolation then that these things then lead to, are all forms of racial trauma and all things that exacerbate racial trauma. We need to start with the structural racism. For all too long, again, but society has kind of couched and painted discrimination as kind of chance occurrences or things that don't happen often. And when we think about racial discrimination, especially killings, as being chance or one-off occurrences, then we're not really thinking about these things as being the product of structural racism, right? But when we think about these issues and these instances of discrimination and killings of being the products of a system that was designed hundreds of years ago, right, to benefit relatively a few at the cost of many, at the cost of BIPOC people, then we can see how these are normalized events that we can just expect to happen, right? And if we can expect something to happen, that means that we should probably be doing something structurally to help prevent it from happening. And so taking this structural, more institutional perspective first will help us to understand that in a greater nuance. This definition of structural racism I find to be very spot on. It's really a silent opportunity killer. Again, it's something that has been woven into the fabric of every institution in this society. And so much so that it often operates at the unconscious or subconscious level of experience. However, when we have a disaster such as the pandemic, these things come to light and we start to see the veil is lifted and we start to see really these harmful operations that are operating across our institutions that are really creating the barriers to opportunities for people of color. We might think about, when we think about structural racism, we might think of decades ago, the Jim Crow laws, separate but unequal is what it should have been really called. Because as we see in this depiction of water fountains, they're separate, but they're definitely not equal. But however, these things still kind of exist. And it's kind of really important to think about these separate but equal laws and understand that separate but equal still does exist. There's still segregation. Schools are not really integrated like they were dreamt about decades ago, right? There still is a lot of segregation that happens in this country where resources are not distributed equally and resources are not available and accessible, especially culturally relevant resources for communities of color. We have to think about how this country was even initially founded, and it was founded on genocide. Right? The textbooks usually don't use that word genocide, but that's really what it was. I think we need to be very truthful and start calling things what they are instead of sugarcoating them. It was founded on colonialism. When 90% of a people is annihilated, that's called genocide. Today, we only have about 7 million Indigenous people living in this country. Most of us are occupying stolen lands, and it's important to acknowledge that. Land acknowledgements become important. So I am calling in from Brooklyn and I occupy the unceded lands of the Lenape people who are the original tenants and keepers of this land. And I also acknowledge that true justice for Indigenous people will not be actualized until all the lands are given back over to them for their control, right? And it's important that we sit with that idea that justice for people in this country is going to take a lot of redesigning for it to actually happen, right? And so it's important to think about, again, the history of this country and where we're situated and how come and how we are benefiting from a lot of these issues still. I like us to talk about intersectionality, right? So we're talking about race and racism, but we have to think about the other isms and how they kind of come into, how they collide and how they're interlocking. And so we think about the amazing work and the gifts that Kimberly Crenshaw gave us, this critical theory scholar, intersectionality scholar. However, intersectionality has not been really spoken about in terms of how Professor Crenshaw originally meant it to be. And so we often think about, I think in mainstream society, when intersectionality is used, it's really thought about on the individual level of the multiple identities that we all hold. However, it was really thinking about the systems level of oppression, how the original work was done, focused on Black women in the workplace, and how they were not. No, I didn't know that they were from Ohio. Oh, awesome. So even more relevant, but that Black women in the workplace were not protected by employment rights that protected women, because women were, when you don't consider race and you include women as an aggregate, women were employed in positions. And when it came to race, they weren't protected because Black men were also being included in those aggregate data. But when you disaggregated the data, we found that Black women were not enjoying the same types of benefits as women or Black men, right? And so we need to think about intersectionality not just on the individual level of experience, but in terms of how systems will work together to marginalize even more so people with multiple marginalized identities. It's no surprise then why Black trans women are some of the most threatened women and people in this country, because of the interlocking of those various systems and how they create the oppressions on the individual level. We can think of structural racism in terms of the representation of people on our college campuses. If we were to think about the entire population of colleges and universities to be one national college or university, this is what the demographics in 2018 would look like. I want us to look at the faculty. We often think about student demographics, but we often don't think about, well, what is the demographics of the campus that they are kind of entering into, which is equally important, right? That's another issue. As institutions became more integrated, or as they started to accept more students of color, they were accepting them into institutions that were not fully prepared to serve students of color. Again, these were still systems that were created primarily to serve white students, and they currently still are. And if we look at the faculty, we see that almost 70% of faculty are white. And we look at the percentages of faculty of color. I'm Latino, and so we look at Latinx faculty only make up around 5% of faculty around this country, whereas 20% of students identify as Latinx. So what message does that send for a student who maybe as an undergraduate may never have a faculty that has their same racial background? What might it look like for them? I was a student like that at the University of Wyoming. I didn't know of any faculty of color, Latinx faculty in particular, in my program. And that did send a message to me. I actually delayed, my journey of becoming a psychologist. And as I kind of think about what went into that, it may be, maybe that lack of representation sent subconscious messages to me about my place in the academy. Maybe it sent messages that people like me don't belong in a professorial role, or don't belong in the role of a psychologist, right? And so representation does send messages, and it does send very critical messages to students in terms of who they are and who they can be, right? If they can't, students cannot become who they can't see. President Shirley Collado at the college, I was recently on a talk with her, and she made that statement, students cannot be who they can't see. Right? And so if there aren't adequate representations of people of color in staff and faculty roles on campus, it's going to send a message to students about who they are and who they are to be on that campus. So this brings us down to microaggressions. So I didn't start with microaggressions purposefully, because microaggressions really are the glue that keeps structural oppressions intact. Microaggressions stem from structural oppressions, right? For all too long, I think that, again, microaggressions have been spoken about more on the individual level, right? It's just that person is being oppressive, without thinking about, well, that oppressive person was also formed into that oppressive person based off of their socialization into society, right? And so we need to connect microaggressions back to structural oppressions. So microaggressions, I'm sure all of you are probably very familiar. You just have to turn on the TV. I hear probably the term microaggression in the media and even on sitcoms on a regular basis. But there are these, very brief, commonplace experiences, and we say brief because they happen on a regular basis, probably a daily basis for marginalized folks. They can be intentional or unintentional. That's often an issue as well. People often want to get focused on the intention behind a microaggression, when we really should be focusing on the impact of a microaggression. The impact is already there, right? So why even focus on the intention for why the impact has already been occurred or experienced rather? So how might they look? They might look like demographics again, like we already spoke about. They might look like people's histories missing from curriculum, right? And so how inclusive are curriculum? I've been doing a lot more trainings for faculty in particular, thinking about how to include a trauma-focused inclusive curriculum. Cultural programming. So we have cultural months. Currently, we're in Asian American Pacific Islander Heritage Month, which is fantastic that we get to celebrate people for an entire month. However, if our campuses are only celebrating people of color for the month, or women as well for the month, or even a disability awareness for the month that we're kind of federally given, there's something wrong there, right? Because we're occupying this university college environment for 12 months. So one of my jokes is, Hispanic Heritage Month overlaps both September and October, September 15th through October 15th. And I joke, I take both months, right? So I take both September and October. And that's my joke by saying that, we should be celebrated and affirmed 12 months out of the year. Yes, we can have 1 month to highlight things. I think we still need to do that because there's still such a disparity, but we need to be doing these things 12 months out of the year. And then where do students find home on campus? I myself, as a student, found my home in the Multicultural Resource Center. And that became a very critical counter space for me to experience, affirmation in light of the invalidations that I would experience outside of those doors. However, if that's the only place that a student of color feels comfortable or affirmed on a campus, that's also problematic, right? A student should be able to navigate the entire campus climate without feeling threats or without feeling invalidated. What might these look like? And so the top one, these are students from a variety of campuses who did a campaign kind of showing the different types of microaggressions that they experience. And these are also very common microaggressions that people experience in daily life across contexts. So just for a Black woman having an opinion and expressing it, you're automatically targeted or called angry, right? And that has to do with the criminality of Black people. Over criminality. We know that Black girls in particular are overly punished in K through 12 education. And so we know that that's just the beginning of the school to prison pipeline, right? And so it continues. Black people continue to be ascribed criminality status. Starting down on the left, know where are you really from? Not a bad question to ask someone where they're from. However, this is probably the follow-up to where are you from? And this young person probably already gave an answer. Most likely it was an answer of one of the 50 states. Maybe it was California. Then the follow-up question, where are you really from? With an emphasis on the really, right? That communicates something, right? And you see this young person, if you're able to see this young person has their eyes rolled upwards, kind of as a, not again, I'm being questioned about my Americanness or about where I'm from. People are assuming something about me based off of how I'm looking, right? So it's not bad to ask someone where they're from. It becomes microaggressive when we don't believe that answer, and then we start to push them for an answer that we have already predetermined, right? That's what's going on with microaggressions. They're coming from predetermined stereotypes that are just being kind of wildly thrown out there in society. The middle one talks about a common experience that students of color experience in the classroom. So the limited representation of my race in your classroom does not make me the voice of all Black people, right? And so most likely the student was asked, how do Black folks kind of experience this issue, right, in the class, where no one can answer the question for their entire group. All you can do is answer your own experience, right? So that's an example of racial spotlighting, where students of color are asked to participate, not to give their own true intellect, but rather to give the voice of their entire people, which we just know is not a realistic thing to do. The opposite of that is racial spotlighting or racial ignoring, where students of color are just not called upon. Or if they do and they give an answer, the answer that's recognized is the answer of a white student, for possibly, and then the answer is then validated. And the last one I kind of joke about, because I get this one all the time, I just got it this week. When I was giving a speech about racism, the MC introduced me as Jaime Garcia. My name is Jaime Rodriguez. Not all Latinos have the last name Garcia. I can't tell you the number of names, last names, Latino last names that I've been giving: Ramirez, Rodriguez, Gonzalez, Garcia. It just goes on and on and on. What this does is it sends a message that people are just not taking the time to learn names. I often hear students who might have a name that may not be maybe new to somebody, where a professor might say, oh, I'm just going to call you Kate, right? Just because it's a shorter version of whatever name they can't pronounce. Now, let's kind of take some time and learn our names are important. Names, we attach a lot of value to our names as part of our identity. And when someone is told that their name is too difficult to pronounce or their name is just too difficult to remember, that sends a message about their identity. They might think that, am I not rememberable? Am I not remarkable? Right? Am I that easily to forget? And all this leads to internalized oppressions, which is something that isn't talked about a lot. And so this stems from, again, the structural oppressions that create the microaggressions. The bombardment of microaggressions that somebody experiences on a daily basis then leads to the internalized oppression, right? People, we think about learning theory. The more that you are told a message, the more likely you are to believe it, even if you don't agree with that message. Right? There's also the mere exposure effect, for example. The more you pass something that you don't like, let's say it's a tree that you think is ugly, but you pass it every day, you're eventually going to develop some kind of maybe ambivalence towards it. Maybe you actually start to like it because you just see it all the time, right? Same with these negative stereotypes. The more that you hear them about yourself, the more likely they are to kind of take root and to take a life. Even if you don't consciously agree with them, subconsciously you might agree with them. And so the internalized oppression happens when we start to kind of endorse these negative stereotypes about our race. And we can then start to then think about ourselves in these negative stereotypic ways, where that critical voice, right, that voice that we have in our minds that's always kind of directing us and talking to us, that self-talk. Hopefully it's talking about our strengths, but when internalized oppression is around, it's often more critical. It's often telling us, yeah, you are stupid. Yeah, you don't deserve that college degree. Yeah, you don't deserve to apply for that job, right? They can also start to then lead us to think negatively about people of our own groups, where we start to then think negatively about other people of color, right? Or other women or other queer people. So the impacts are very grave. A couple manifestations of stereotype threat, which hopefully y'all are already familiar with. This is the idea that, again, these stereotypes can be so ingrained in us that even if we don't agree with them, that they're still there. And just being reminded of it, let's say, and this was studied in standardized tests, so just being reminded of your gender or race before you take a test can lead you to act in those stereotypic ways, even if that doesn't represent your true intellect or your true abilities. Removing that prompt will then allow people to act in ways that kind of represent their optimal intellect. Imposter phenomenon is a huge one. And I really encourage you to talk about your peers, your families, and your students, and anyone that you work with about this. So it's that voice, again, in your mind that's often critical. And everybody has this regardless of race, regardless of gender. However, people of color and oppressed folks have imposter phenomenon that's also including the oppressor's voice. And so it might be that voice telling you, again, you are stupid, you're really not that smart, or it's just a matter of time before you're found out to be the phony that you are, regardless of all the education that you have, regardless of the experiences and employment that you have, regardless of the accolades that you may have earned. I still deal with this on a regular basis. And so what I do is I know what it is. There's relief in this knowledge. There's relief in just the consciousness raising of being able to understand what this critical voice is, where it's coming from, and how it originated. That by itself can be freeing. That by itself can be an important intervention. I see that we're running out of time, and so I wanted to go over also some information from the Healthy Mind study that the Steve Fund collaborated with towards the beginning of the pandemic, where we were able to see racial differences in students' experiences on campus, specifically in terms of supports. We want to know, we want to make sure that students are not that supports are available, but that students are also accessing them. And what we know is that when students feel like their campuses are hostile, they're not going to go and look for support in that hostile environment, right? Who would do that? That just wouldn't make sense. So it's important to kind of understand the perceptions of students of color on campus, but from a disaggregated perspective, right? And so we found that students of color had various perspectives in terms of their experiences on campus. So I'm not going to read all of these. The last one I find extremely salient because I know I'm a professor, And what this finds is that Black and Latinx students were less likely to view their professors as sources of support during the pandemic compared to other students, including other students of color. Right? That's a very powerful statement, because what we do know is that the professors through the pandemic many times in many universities and for many students became the sole front-facing representative of that institution, right? And so if they're feeling like their only representative is not someone that they feel support from, they're probably going to feel at a loss for support from that entire institution. We can think of differences in experiencing and witnessing racism, for example. We knew that Asian students were more likely to experience discrimination in the pandemic than any other race of students. And we know that that was primarily due to the rhetoric caused by the previous administration in terms of how they were labeling the coronavirus, right? Using a geographic name, which we know only leads, the World Health Organization told this to us already, that only leads to discrimination, right? And then we have the highlight of that in this country and in the United States. And I'm calling in from New York, which I think is one of the most diverse places in the country, and also possibly one of the more tolerant places in the country. However, we still see Asian American Pacific Islanders in New York City being overtly hurt and stomped on. And so we see that there's differences in how people are experiencing discrimination and witnessing it. But we do know that the impact for students of color is grave. For undergraduates and graduates, that they are likely to experience anxiety and depression at higher rates compared to white students during the pandemic. Where are they going to help? They're not going to people like us, unfortunately. They're usually going to friends and family first. Only about 6% go to a university-affiliated therapist. We want more to go, right? But we also need to be thinking about the entire community as being part of the answer to the solutions, or part of the solutions to the issues, right? And so we need to think about how can we critically involve the organic, naturally occurring support system of students of color, right? Their friends and their parents. And we also know that friends and parents are saying, I feel ill-equipped to help my peer or a student, right? And so we need to think about how can we include parents and friends more intentionally in our interventions. We can think about shame and stigma, again, leading to silence. We know that in general, people live in silence often for 10 years before they seek help when they're dealing with a mental health compromise. People of color probably living for longer in silence, right? There's a lot of stigma, a lot of it that has to do with the incredibly harmful ways that people of color have been treated by the healthcare establishment in this country for hundreds of years. Think back to the Tuskegee syphilis studies in which Black men in this country were given syphilis and were not, and once the treatment penicillin was available, it was withheld from them. And they were forced to live with it just to kind of study the negative impacts of this disease. So that still deals. And that kind of all goes to this racial trauma. And so racial trauma, it's real. Racial trauma often mimics or looks like PTSD. So again, we have a framework as mental health professionals in terms of how to understand racial trauma. People that kind of talk about their racially traumatic experiences often talk about it via PTSD language, right? So they might avoid talking about it, right? They might not want to talk about it because it's just too much, or because they've experienced it time and time again. They know what it is, and it's like, well, why am I going to talk about it again? It's just going to make me feel crappier about myself. Easily frightened, negative thinking, avoiding certain places, maybe places where they have experienced the racial discrimination, avoiding certain activities. Right? So if somebody is experiencing racial discrimination in the classroom, maybe that is the reason why they're not returning back, right? It might not be that they don't care about their education. It's probably that they don't care about, or they don't care to experience the discrimination in the classroom, for example. And so maybe that's a reason why we see lower rates of educational attainment for students of color, right? They go to campus during that first year. They're like, damn, this is not a validating place for me. And then they tend to drop out, or they might drop out. Substance abuse as well, right? And so we know that maladaptive coping mechanisms through substance, people that experience trauma often turn to substances, right? Because these are chronic issues, right? And substances are a very easy, accessible means to numbing oneself and not feeling a certain way. And so we might see upticks in substance use for people that are enduring racial traumas. So what can we do? Again, I want to encourage us to move more into prevention. I know we often do remediation. We often do remediation in institutions that are oppressive, right? Where the structures have not been changed, because if the structures are not changed, we can just assume that the oppressions are going to continue, regardless of how many remedial interventions we have, right? And so we need to think about, are our campus interventions more remedial in nature, or are they more preventative, right? And how can we kind of move towards prevention? The equity and mental health framework that I mentioned earlier is one of those interventions that was designed to be more preventative in nature, right? And so this is just an example of it. You can go to equityandmentalhealth.org to find out more information about the equity and mental health framework. The STEVE Fund has a relationship with the National Center for Institutional Diversity at the University of Michigan, and we also developed a campus climate video toolkit with them. I'll put this website into the chat as well once I finish the formal talk. But this is a toolkit where you can learn more about campus climate issues and kind of the things that we should be doing to interact with campus climate from a prevention standpoint. So there are a number of educational videos here. Engaging with culture, again, we need to work with it through the entire relationship, being aware of our power, checking our assumptions, taking a culturally humble stance, being intentional about our language, knowing that we often use oppressive language. A lot of our language is very ableist, right? And so using ableist language, such as blindness, right? Or disabling something. Let's use different language. Disabling means turning off, right? Let's just use turning off, right? Using the blindness means we're just not seeing it. Well, maybe it's something that's being evaded, right? So let's not use those kinds of terms as well. Using black and white as well as adjectives or descriptors can also perpetuate the racial connotations that are also used for colors as well, where we think of black as dirty, black as not desirable, white as clean, white as pure, right? Those can also uphold racial or racist ideologies as well. Knowing our limits and seeking out more support. Again, taking this culturally humble perspective. It's a relatively new concept that's been being infused into mental health, especially psychology. We can think of the multicultural orientation and how cultural humility is a part of that. But all that basically is, and it sounds very simple, but it's kind of just checking your own worldview, knowing that how you understand things is not how anybody that you interact with understands something. And so we might need to check, our ideas for what does wellness even mean? What does education even mean for our students? What does seeking help mean for our students? And what does healing mean for our students? I want to start there and then work from there, right? Because my ideas of healing are likely different from my student ideas of healing. One of the final things I want to go over before we open it up for questions is a racial trauma recovery plan, right? And so as I was mentioning, if we can conceptualize racism as being a normalized part of society, right? That's what critical race theory tells us, and that's what all of the data that even the federal government gives us on educational and employment attainment rates in healthcare and health access issues. We see that people of color are disproportionate in very consequential terms amongst all those issues, right? And so if we know that we're just going to experience these things, we can plan for it. And so thankfully, researchers at Boston College, led by Dr. Janet Helms, who is a Black counseling psychologist, an elder, in my profession and in my communities, somebody who really gifted us with the language of racial identity, is also part of the team who gifted us with a racial trauma recovery plan, right? That we can actually do something about it. And I'm going to take you through it. This is the website that you can go to not only find an article, but you can find an infographic on this, and you can find more information for how to really help people plan for recovering for racism. So if we know it's going to occur, we can then be intentional about planning for it, right? And this is kind of going into possibly a hybrid of remediation and prevention, right? I can possibly prevent some of the negative outcomes if I can intervene with it much sooner and not just kind of let these oppressions live unchecked. So part of it includes reflecting upon, responding to racism in a healthy way, reflecting, being very conscious about our daily upkeep for our wellness. So what are our daily coping strategies that we use, and which ones might we also use to deal with racism? Identifying the various raceful situations. I know that when I turn on the news, I'm going to encounter some kind of vicarious racial trauma. I just know that. So I don't watch the news very often. I'm very judicious with my social media and my news intake because I know those are two primary sources of racial trauma, right? And so I can part of this, what I can do for myself is remove myself from those contexts. But I know that when I do turn that on, I'm going to have to be prepared to do something afterwards, right? So I can identify stressful situations, anticipate warning signs. Sometimes it lives physiologically. What's my acute response plan? So what will I do in the moment? Maybe I'll do a mindfulness breathing exercise. Maybe I'll text a friend. What's my crisis planning? What else will I do? Who else will I contact? What else will I do post-crisis recovery, right? So if it's a more major issue, I know I'm going to have to engage in some more nuanced coping strategies. Maybe I need to go to a therapy session. Maybe I need to go and engage with my community in more for a longer amount of time to kind of get that healing, et cetera. And so this racial recovery plan, I would just really encourage you to circulate this widely. It's something that is pretty self-explanatory. Doesn't even need you to explain it so much to a student, as opposed to kind of let them know that this is a way to kind of help you deal with racism that you can just plan to encounter on a regular basis. So I'm going to actually stop here.
And I just want to thank you again, Dr. Rivera, for a very enlightening presentation. And I also want to thank you for highlighting a new term that I learned, racial spotlighting and racial ignoring, as we know that this happens very often in our campus classrooms, that students do feel as though they have to be that one and only representative, when they're the only person of color in those spaces. And so I just want to thank you for highlighting that new term for me that I'll add to my repertoire in terms of vocabulary.
Awesome.
Again, thank you so much for the presentation. Again, thank you, Dr. Rivera, and everyone feel free to stay here. That video slide presentation will be up very shortly. Thank you again.
Good morning, everyone. I'm happy to be with you here today. I'd like to thank Dr. Ruth Samara and the leadership at Neomed for bringing us together to talk about the mental health needs of Ohio's college students, especially those in minority populations. From the pandemic to social unrest, we have faced incredible challenges over the last year, resulting in feelings of fear and isolation and loss for many Ohioans. This is especially true for young adults who are getting ready to begin their college experience or perhaps enter the workforce, very monumental steps in their lives that were significantly disrupted. Promoting suicide prevention and mental health awareness and stigma reduction activities on college campuses has become more important than ever. And you are instrumental in this work. I want to thank you for all that you're doing day in and day out to make your campus community safe and welcoming to all. You are truly making a difference. From the onset of the pandemic, Governor Mike DeWine recognized the importance of mental health, and he quickly mobilized state resources to ensure that the behavioral health field remained open to Ohioans. From expanding telehealth to launching Ohio's Careline to public awareness campaigns, we focused on reducing the stigma around mental health and ensuring Ohioans had access to support and treatment. Those efforts included a strong equity lens to ensure that each Ohioan had access to care and resources, no matter their age, ethnicity, gender, socioeconomic status, or geographic location. Equity is part of all of our work at the Ohio Department of Mental Health and Addiction Services. And ending disparity in behavioral health care isn't a special project for us. It's a core value that we operate from and a cultural expectation within our organization. We work each day to be better at meeting the needs of all Ohioans. Advancing health equity plays an important role in our efforts to ensure access to quality services, while also addressing social determinants such as employment and housing stability, insurance status, proximity to services, and culturally competent care. Ohio has made significant investments of state and federal resources to address health disparities and promote healthcare equity among diverse populations. And despite the challenges of the last year, I believe we have been given an incredible opportunity to leverage the innovation, creativity, and lessons learned during a crisis to deliver even better care for Ohioans struggling with mental illness and addiction. We value your partnership as we work together to meet the behavioral health needs of college students, faculty, and staff, and to better understand the needs of students of color and intersecting identities. Thank you for taking time today to learn from the experts and from each other during this conference. We need your skills, but most importantly, we need your caring approach and your perspective from the communities that you serve. The conversations we are having and the work we are doing together are critical to reducing stigma and removing barriers. Thank you. I hope you have a great conference.
Suicide is not just a community issue, it's a college issue.
I don't want folks to be scared of the suicide topic.
We all need to come together and show that we value this as an issue and we recognize we need to do something about it.
It takes a wise and bold administration at a university to step up and say, yeah, we're going to teach this. A lot of people in various health professions and education professions and even in mental health professions have very little knowledge and understanding about suicide.
I know in counseling, suicide prevention training is something that they want us to focus on, but it's not required.
I even remember going through school and not getting a real heavy dose of suicide education. But when I went into the field myself as a young social worker, I didn't have enough to go on to even meet with a client who was suicidal and know what to do.
We need to have a focus on suicide because it's a critical issue within our society, and it's something that's important and deserves to have an individual focus.
Suicide doesn't discriminate. Every college campus is a place where students might be struggling.
There is a lot of pressure for students to excel, pressure that may come from their families or just themselves. And students in university settings might not know how to help their friends.
It didn't just heighten their awareness. It didn't just heighten their knowledge. It really emboldened them and empowered them.
They tell us that they come into the course nervous. They come in because they want to feel more competent. And then when they leave the course, they know what to do. They know how to help.
These aren't just clinical skills. These are everyday people skills. You could have people who are suicidal in your own family, and these skills help you recognize it, helps you be present with someone who is suicidal. Because when we're losing, 48,000+ people a year to suicide, and when it's the second leading cause of death in young people, it is a critical skill.
With this course, we're focusing on community effort. Our course is more of a all come and be involved and learn together type of process. So I think that's the unique aspect that this course brings to other courses that are being developed perhaps in the state or across the country. The topics that the students learn about in the suicide prevention course range from interprofessional suicide prevention topics through to very specific interventions for suicide.
We developed a robust sort of compilation of current literature in theory and practice and research evidence and public health.
We help them to understand not only the roles that people play in suicide prevention, but also the resources that are available in their community, so they're aware of that and they know where to refer. If you walk through the material on your own, it's really easy to connect with, especially if you've had prior experience with suicide prevention. If you listen to the PowerPoints and review the materials that are already provided, I think you'll find that it's not as daunting as it may first appear.
Interprofessional education suicide prevention course can be implemented at any higher education institution. I think that universities who can step up and say, this is important to us, and we know it's not just enough to have a workshop or a seminar. We want a course. So I would like to see more courage. I would like to see more universities stepping up and saying, this is the kind of stuff we want our students learning.
If there are individuals or institutions that would like to consult with me on the development and implementation of this course, I am available to consult if they have that need.
I would be happy to work with any university or college or campus who would be interested in implementing this program. There's only one way to work toward a zero suicide world, and that's to take a program like this and get serious about it.